on the national response to protecting the mental health of individuals. Do you believe that it's been sufficient, and what do you think could have been done better from a state perspective?
As far as the national response is concerned, very much like India and Sri Lanka, the initial responses have been fragmented, ad hoc efforts. You keep hearing these random reports in different medical institutions, or some helplines with online counseling set up by NGOs. At the national level, for the first time, the Ministry of Planning, Development and Special Initiative is launching a MHPSS initiative soon. We've been planning and working for this for 3 months now. It's a multi-level initiative as recommended by Interagency Standing Committee guidelines. And it's a very comprehensive, integrated web-based web-based plan. We followed a hybrid model. So there is the digital solution to it, but also we are trying to ensure a person-to-person contact with counselors or mental health professionals if needed.
You also have to look at what was the existing infrastructure and human resource availability that you had before COVID to say that, oh, have we done better or have we not done as well? And I think if you take that as a measure, then I'm quite enthused by the fact that the government has actually put in a reasonably good response. Given the restraints and constraints that do exist, they have tried to do their best. One of the most important things about the mental health response in India, which I think is quite interesting and I hope it lasts, is the fact that there is a huge awareness. I mean, even among policymakers as well as the general public. Now, this is something we've been trying for many years, but not with great success. But it required a tragedy like a pandemic to actually make that happen. So, we've had our Union Health Secretary, which is the topmost health bureaucrat in the country, write a couple of articles on mental health issues in big, large newspapers. For example, we've had ministers talk about mental health, which wouldn't have happened up to now. And there's been a kind of, even among social media in India, mental health is quite high on priority. So there's always a talk about the COVID treatment, and then there's mental health. So in that sense, I'm quite enthused by it. The challenge really is going ahead. What I'm worrying about is the fact that mental health problems are going to hit India with a certain lag. 6 months down the road or 12 months down the road, we're going to face a lot more problems. And I don't see at the moment us doing anything to get ready for that deluge, in a sense. The mental health response has been a very narrowly biomedical, biopsychological kind of an intervention. So it's been like, let's have some counseling, let's help people. And what is really missing is the social interventions that are required, either to prevent mental health problems or to even address mental health problems. I think that's a real huge lacune in our response.